Hi, I'm Dr. Matt Velosin, and today I'm going to be discussing with you the Mako Robotic Total Knee Surgery. My surgical practice revolves a lot around arthritis of the knee. We do a lot of work and a lot of treatments to try to avoid getting to the operating room, but sometimes the treatments will just not work anymore and we have to move on to surgical correction of knee arthritis. Once we make that decision, trying to get a total knee that is fantastic for the patient is the #1 priority.
My goal is to provide the best surgery I can for my patients, and so if there's a technology that can help me put parts in for a total knee more accurately and more precisely and fit each individual better based on their own personal anatomy, that's something I definitely want to look into. And so when I looked into the Mako as an option for being able to do this, I just thought that it was better than anything else I had seen on the market in terms of being able to most accurately place these knee replacements in hopes that they will last even longer.
What makes the Mako Robotic System an ideal choice for total knee replacement for patients is twofold. One, less pain and quicker recovery, and two, the longevity of the implants once we are able to get the implants into the patient. They will last longer if we get them in absolutely precisely.
For the Mako, for being able to plan the knee, the size and the parts and the location, we have to get a CT scan. So that's part of the preoperative process.
Utilizing that information, we put that into the computer and able to get a 3D model of your knee prior to the surgery, which will allow for sizing and the absolute most precise components that we can put in. The second part is during the procedure, we use that CT scan and add to it GPS monitoring of your knee during the procedure, which allows us to have a 3D reconstructive model during the procedure. So whenever we get the implants in, we are able to see that it is in exactly the way that it should be in for your particular knee.
What the robot does is it helps guide those cuts more accurately than if we were doing it just on our own without this computer assistance. And so the robot does not do it by itself, but it does assist in more accurate cuts of the bone.
We do not have to dissect nearly as much during the patient's procedure, which leads to less pain afterwards. We are able to get these implants in precisely, which leads to a quicker functional recovery, and it's also a very specific patient knee. We are able to utilize the information that the robot is giving back to us during the time of surgery so that it acts exactly the way that that patient's particular knee wants to act. It gets them back to the knee that they were used to before they had arthritis. Partnering with Wayne Memorial Hospital was very exciting in adding robotic surgery to what we're able to offer our patients. We live in a small town and robotic surgery and that innovative treatment is not something that is common. The partnership and the dedication of the hospital to their community has been very exciting so that we can bring innovative treatments to the patients that may only be available in big cities, but we have them now in our small towns.
One difference I've seen so far with the Mako recovery process compared to the way we had been doing them is because it involves a little bit less dissection in order to be able to make the cuts because the robot is helping us. The patients seem to be recovering a little bit faster. They're not quite as stiff. They're getting moving a little bit quicker. I'm seeing fewer patients need walkers coming in at their 2-week visit. A lot of patients are coming in with just a cane or even nothing by 2 weeks.
I've been doing knee replacement surgery for the last 10 years, and what I have been seeing in my patients since I switched to robotic total knee replacements is an increase in satisfaction, a decrease in pain, and an overall quicker recovery time to function, and just an overall happier patient.